We are faced with a number of questions right now about stem cell therapy. And the most common one would be, what is our time frame for being operational in this field? And are we going to be able to offer stem cell treatments in a timely fashion? We don't know for sure the timeline here, but what we can assure you is that we have done all of the preparations to be fully operational in a very short period of time once we receive the approval from Health Canada. The second question is, patients have asked us, why are there other clinics in Canada still advertising stem cell therapy? While I can't comment on the behavior of these other clinics, it is clear that all of the clinics in this field in Canada have received the same notification from Health Canada that if they are going to be using cellular therapy for any application, they must have filed a clinical trial application with Health Canada for permission. The third question is, how can I tell if a clinic has their clinical trial registered? Well, firstly, you can ask the clinic. And secondly, you could go to clinicaltrials.gov, which is a database listing all of the clinical trials currently on offer. A final question we get frequently asked is, I'm considering going to a stem cell clinic in the United States. What questions should I ask them? Firstly, you would want to know where they are getting the stem cells from. And if this clinic is using birth products, such as umbilical cord cells, placental extracts, or amniotic fluid, you need to know that those substances contain no living cells whatsoever, even if the clinic claims that they do. These birth products don't have viable cells, but they are simply containing some proteins and some growth factors. The preferred therapy is to harvest the cells actually from your own body. So you would want to make sure that a clinic you're attending is harvesting living cells from your own body. The next question would be, is their protocol approved by an institutional review board or an ethics committee? And this is important because it helps to protect patient safety as well as the integrity and the confidentiality of the data that they collect. The next question would be, what do they offer in terms of follow-up care? Keep in mind, if you're going to a foreign country for treatment, you would want to make sure that any complications could be dealt with by the treating clinic. And lastly, you would want to know if they're tracking their outcomes in a data registry. This is very important as it allows us not only to track complications, but also outcomes over a sustained period of time. And this is the way that medical science is advanced. If you have any additional questions that I haven't answered today, please be in contact with our clinic, as I will be addressing these types of questions on a regular basis.